Meet George. Social services have had concerns about George's mother and her ability to care for him appropriately. Because of these concerns, George has a child protection plan in place to help safeguard his well-being whilst remaining in the care of his mother. They have just moved home, and George is new at school. Whilst at school, George's teacher, Miss Jones, notices that a wound on George's arm has got progressively worse over the course of a week. George tells her he was bitten by a dog, and she's concerned that the bite has become badly infected. So Miss Jones tries to ring home to speak to his mother, but gets no answer. So Miss Jones takes George to hospital to get the bite treated. Because of the Child Protection Information Sharing System, the clerk in reception informs the medical team that George is on a child protection plan. Because George is new at the school, Miss Jones has no idea that George is on a plan. The doctor is happy that the dog bite was accidental, but because of the Child Protection Information Sharing System, he knows that George is on a child protection plan. He's concerned that no treatment has been sought and that the wound has become infected. The doctor rings the social care team from the local authority where George used to live, whilst the nurse dresses the wound. He discovers that the reason George is on a child protection plan is because of neglect. The social care team are very worried about this scenario and recommend that George is not sent home until a social worker arrives. George is collected by a social worker who takes his prescription and takes George home. They're alerted that things at home might be bad and some kind of intervention may be necessary. But what would have happened to George if the Child Protection Information Sharing System was not installed at this hospital? Without the Child Protection Information Sharing System, the medical team would have had no idea that George was on a protection plan. The doctor could have dismissed any fears about why the bite had become infected as a one-off event or oversight by George's mum. The doctor would have released George and the teacher would have sent him home. Without intervention from the social care team, it's very likely that George would not have completed his course of antibiotics or gone back for a checkup, causing a potentially serious infection to develop. Luckily for George, the social care team provided a valuable intervention at a time when George's mum was obviously unable to cope. The Child Protection Information Sharing System not only provided a radically better clinical outcome, but also allowed for an intervention from the social care team at a crucial time for George and his mum. The information sharing allowed by the Child Protection Information Sharing System not only saved George from a potentially serious medical situation, but alerted the social care team. Without this, George's neglect might have become even more serious.